Hi there, Melissa Boudin, licensed clinical psychologist, here today to talk about your first therapy appointment, what that process looks like and what you can expect. Okay, so you've booked your first appointment. You've just made this incredible leap towards making some really amazing and positive changes in your life. What comes next? First things first, when you book that first appointment, you'll be asked to complete some paperwork for your therapist. The paperwork should only take a few minutes, and it includes important information about privacy and confidentiality and asks for your consent to receive services. It also asks for some background information, including information on your reason for seeking therapy and a bit of history. It is so important to complete that paperwork prior to your first session because it will help to serve me or your therapist in preparing for that first session together, and it will allow us to focus more time during that session on the issues at hand rather than taking time out to do paperwork. For your first session, come as you are. There is no need to prepare anything. If you are nervous or thinking you may not know where to start or what to talk about, I want you to know that I will guide you. I will ask questions to get to know you, and you'll be able to ask questions about me, my experience, my therapy style, or about things that are important to you. We will talk about confidentiality, and I will ensure that you know what that means when it comes to what we talk about in session. We will discuss what brought you into therapy and what you're ultimately looking to get out of therapy. You may not quite know that yet though, and that's okay. That is something that we can work through together. In discussing your goals or what you're looking to change or accomplish, we will also discuss a course of treatment, and that discussion will include how long therapy may last and how often it makes sense for you to attend therapy. Again, this will be based on the goals that we collaboratively set. When you leave your first session, you will most often have an understanding of what you'll be working towards. And you may even already have some strategies to take home and begin implementing in terms of change. Again, that depends on what you're seeking in therapy. You should have an understanding of what therapy will look like, when your next session is, and what to expect for that session and perhaps the next few sessions. Many people leave their first session already expressing newfound hope for the future and looking forward to returning. I think this is a good point to remind you, though, that therapy is like any other relationship. Sometimes you may connect right away with a therapist, and sometimes it can take a little bit to build that connection. And it can take a few sessions actually to feel connection or trust in a new therapist, and that is okay. Give it that time before deciding that therapy or a particular therapist, whether that is for you. The time invested in that relationship will ultimately be so very worth it, and I'm excited for you to have that experience. Thank you for tuning in, learning a little bit more about getting started in therapy, and I can't wait to meet you at our first session.